Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, in this video we can see some important terms for exam preparation. This is the video number 67 of important points section. You will see the terms one by one. First point, polypharmacy. Polypharmacy means the administration of multiple medication at the same time is called a polypharmacy. Polypharmacy means is the administration of multiple more than one medication at the same time is called polypharmacy. It is common in older persons. And the next point, presbycusis, the decreased ability to hear high-pitched tone that naturally begins in midlife as a result of irreversible inner ear changes. That is called presbycusis. Presbycusis means a decreased ability to hear. That is an age-related hearing loss is called. In short, age-related hearing loss is called presbycusis. The actual meaning is the decreased ability to hear high-pitched tone that naturally begins in midlife. Okay, as a result of irreversible inner ear changes, that is called presbycusis, or age-related hearing loss is called presbycusis. And the next point, presbyopia. Presbyopia means the decrease in visual accommodation that occurs with advanced age. Okay, that is called presbyopia. Presbyopia means is an age-related visual disturbance. The actual meaning is the decrease in visual accommodation that occurs with advanced age, that is in old age. Okay, that is called presbyopia. And the next point, sundowning, is an increased confusion at night. Sundowning means is an increased confusion at night. And the next point, pain threshold, the point at which a stimulus is perceived as a painful is called the pain threshold. Next point, pain tolerance, the maximum intensity or duration of pain that a person is able to endure, that is called the pain tolerance. Pain tolerance means the maximum intensity of a pain that a person can able to tolerate, that is called the pain tolerance. And the next point, acute coronary syndrome. It refers to rupture of an erythematous plaque in a diseased coronary artery, which rapidly form an obstructive thrombus. That is, acute coronary syndrome means it occurs due to rupture of erythematous plaque in the diseased coronary artery. Okay, so that is sudden reduced blood flow to the heart due to diseased coronary artery by obstructive thrombus is called acute coronary syndrome. And the next point, afterload. Afterload means the amount of resistance to ejection of blood from the ventricles. Amount of resistance to ejection time. Okay, ejection of blood from the ventricles is afterload. And the next point, preload. Preload means degree of stretch of cardiac muscle fibers at the end of diastole. That is, how much the cardiac muscle can able to stretch the muscle fibers at the end of diastole is called preload and afterload. And the next point, sinoatrial node, that is SA node. SA node is the primary pacemaker of the heart, which is located in the right atrium. SA node, sinoatrial node, it is the pacemaker of heart, is called SA node. And the next point, AV node or atrioventricular node, is the secondary pacemaker of heart located in the right atrial wall near the tricuspid valve. Okay, atrioventricular node or AV node is the secondary pacemaker of heart and is located in the right atrial wall near the tricuspid valve. Okay, and the next point, cardiac output, the amount of blood pumped by each ventricles in liters per minute is called the cardiac output. And the next point, cardiac stress test, a test used to evaluate the functioning of the heart during a period of increased oxygen demand is called the cardiac stress test. Okay, a test used to evaluate the functioning of the heart during a period of increased oxygen demand is called the cardiac stress test. And the next point, contractility. Contractility means ability of the cardiac muscles to shorten in response to an electrical impulse is called contractility. Contractility is the ability of cardiac muscles to shorten in response to electrical impulse. And the next point, systole. Systole means period of ventricular contraction resulting in ejection of blood from the ventricles into pulmonary artery and aorta. It is systole and diastole. Systolic blood pressure and diastolic blood pressure we all know. That is, systole means period of ventricular contraction and diastole means period of ventricular relaxation. Okay, diastole resulting in ventricular filling. And next point, S1 heart sound, first heart sound. The first heart sound produced by closure of the atrioventricular valve is called the S1. That is, atrioventricular valve means mitral and tricuspid valve. And next is S2 heart sound. The second heart sound produced by closure of the semilunar valve. Semilunar valve means aortic and pulmonary valve. That is called S2 heart sound. Next is S3 heart sound. And this is an abnormal heart sound. An abnormal heart sound detected early in the diastole as resistance is met to blood entering either ventricles. So this is an abnormal heart sound occurs in diastole. And S4, an abnormal heart sound detected in late diastole. S3 is detected in early diastole time and S4 is detected in the late diastole. Diastole means a period of ventricular relaxation. Both S3 and S4 are abnormal heart sounds. Next point, summation gallop. The abnormal sound created during tachycardia by the presence of an S3 and S4. This is an abnormal sound occurs during the time of tachycardia. It is due to the presence of abnormal heart sound S3 and S4. That is called the summation gallop. And the next point, stroke volume. Amount of blood ejected from the ventricles per heartbeat is called the stroke volume. And the next point, asbestosis. Diffuse lung fibrosis resulting from exposure to asbestos fibers is called asbestosis. It's an important point. Asbestosis is the lung fibrosis occurs due to exposure of asbestos fibers. And the next point, atelectasis, is the collapse or airless condition of the alveoli caused by hypoventilation. Collapse of the lung is called atelectasis. And the next point, central cyanosis. Cyanosis means is the bluish discoloration of the skin or mucous membrane is called central cyanosis. And the next point, consolidation. Consolidation means lung tissue that has become more solid in nature due to collapse of alveoli. So consolidation means solid lung tissue. Okay, solid lung tissue due to collapse of the alveoli is called consolidation. The next point, copulmonary, is the enlargement of right ventricles from hypertrophy or dilation. It occurs as a result of secondary response to disorder that affect the lungs. So copulmonary means it's an enlargement of right ventricles from hypertrophy. It occurs due to hypertrophy or dilation, enlargement of the right ventricles of the heart. That is called the copulmonary. And embyma means it's an accumulation of purulent material in the pleural space is called embyma. Hemoptysis means coughing of blood from the lower respiratory tract is called hemoptysis. Hemoptysis means coughing of blood. Okay, that is called hemoptysis. And purulent means consisting of or containing or discharging of pus. Pus related secretion is called purulent. In embyma, that is accumulation of purulent material in the pleural space, that is embyma. Like that is purulent means here purulent meaning of purulent consisting or containing pus related material, that is called purulent. Okay.